So I did just present on treatment outcomes and survival in patients with quad-class exposed relapsed refractory myeloma. Generally, quad-class exposed patients are heavily pretreated, with the majority of them being triple and quad-class refractory. What we saw is that in this patient population, the majority of them, had high-risk cytogenetics. We also saw prior BCMA exposure, with most patients having received a BCMA CAR T as well as ADC compared to a bispecific agent in this particular patient cohort. In terms of survival outcomes, we essentially identified that the median event-free survival for quad-class exposed patients is only about 4.5 months, and the median overall survival is about 13 months. We did see that this was particularly overall survival was inferior for patients receiving systemic infusional chemotherapy compared to some of the novel agents such as BCMA and GPRC5D agents after quad-class exposure. And we did see for those with prior BCMA exposure, generally they had particularly BCMA CAR T had a superior event-free survival at about 7 months compared to 3 to 4 months in the ADC and bispecific cohorts. And in terms of treatment patterns, right, earlier in lines of treatment, we have multiple drug combinations that can be utilized. However, in the later lines of therapy post-quad-class exposure, yes, we can use GPRC5D as a novel target, but, recycling of some of the same targets, and there's more limitations in the amount of treatments that can be utilized. And there's a very high attrition rate as well, post-quad-class exposure at about, at least 30% and another 30% at index +1 and index +2 due to disease progression or death.